Hello there, welcome to Dr. Sushant's anatomy tutorial. In this video, I am going to talk about the shaft of the humerus. Please excuse me for the background noise. Like I already told you, I'm not using any software to eliminate the background noise. So this is a raw video in which I'm going to talk about the shaft. Okay, the shaft of the humerus. It is shaft of humerus. So the shaft of the humerus, it's cylindrical, okay, in shape, where in the upper half, but in the lower half it is prismatic, meaning it is triangular on cross section in the lower half, right? And this shaft presents three borders. It presents three borders and three surfaces. Now, what are the borders of humerus? So it presents three borders. One is the anterior border, then there is the medial border, then there is the lateral border. And the surfaces are between these borders. So we have anteromedial, anterolateral, and then there is the posterior surface. So these are the surfaces, borders and surfaces of the humerus. Now let us look at the details of each part of this shaft. So here is the humerus bone. Let us isolate the bone. So the shaft is between the head and the lower end, right? So when you look at the shaft, it is cylindrical in shape in the upper half, but in the lower half it becomes prismatic, meaning on cross section it is triangular in shape, right? Now let us look at the borders of the bone, right? So here is the anterior border, the border that is highlighted in pink color. This is the anterior border of the humerus. As you can see, the anterior border extends from the anterior aspect of the greater tubercle. Right? We know the greater tubercle and the lesser tubercles. So from the anterior end of the greater tubercle, the anterior border extends downwards and it ends here in the lower end between two small depressions. The medial depression is the coronoid fossa and the lateral depression is the radial fossa. So we can clearly see that the anterior border ends in between the coronoid fossa and the radial fossa. Now, when we look at the other border, that is the lateral border of the humerus, look at this. This is the lateral border of the humerus. Right? This is the posterior aspect. This is the lateral border. The lateral border, it extends upwards from the lateral epicondyle. This orange colored area you see is the lateral epicondyle. So the lateral border extends upwards from there and it passes further above where it ends very close to the posterior margin of the greater tubercle. See the greater tubercle, and it ends close to the posterior margin of the greater tubercle. So that's the lateral border. So the border here that is highlighted in pink color is the lateral border. So in anatomical position you can see the lateral border. So this is the anatomical position. You can see this line highlighted in pink color. That's the lateral border going from the tip of the lateral epicondyle all the way up to the posterior aspect of the greater tubercle. In the lower part, that is close to the lower end, the lateral margin is sharp and it is called the lateral supracondylar ridge. So we will talk about the lateral supracondylar ridge in a bit. So this border now highlighted in pink color is the lateral supracondylar ridge. So that's about the lateral border of the humerus. Now the next border is the medial border. This is the medial border of the humerus, the shaft of the humerus. It goes upwards from the tip of the medial epicondyle. So this part highlighted in orange color is the medial epicondyle. So we can see this is the medial supracondylar ridge that is sharp, lower part of the medial border, medial supracondylar ridge, And when you trace it upwards, that's the medial border, now highlighted in pink color. It goes all the way upwards and it becomes continuous with the medial lip of the intertubercular sulcus. So here is the intertubercular sulcus. That's a sulcus present between the lesser tubercle and the greater tubercle. So these are the borders of the humerus. So now tell me the borders. The three borders are anterior. This border is the anterior border. This one, that's the surface, okay? So this one right here, this is the medial border, and more laterally we have the lateral border. This is the lateral border, and remember the lateral and the medial borders in the lower part are sharp and they are given a different name. So on the medial side, the medial border is called the medial supracondylar ridge. So this is called the medial supracondylar ridge. It's nothing but the sharp lower part of the medial border. And similarly on the lateral side also, there is a lateral supracondylar ridge, which is actually thickened lower part, sharp lower part of the lateral border, right? Now a couple of things more about the borders, especially the lateral border. So when you look at the lateral border, so it extends upwards from the tip of the lateral epicondyle, very close to the middle of the shaft. This border, the lateral border, it fades away. You can see this fades away because of the spiral groove. Now you see this, follow this pink line. In the lower part you can trace the pink line. In the upper part also you can see the pink line. But in the middle part, this pink line becomes faded, and that is exactly where we have the radial groove, or also known as the spiral groove. Okay, so beyond the spiral groove, the lateral border becomes continuous with the posterior border of the greater tubercle. Right? Right. So this is about the border. Next we will look at the surfaces of the shaft of the humerus. So there are three surfaces and the surfaces lie between the borders. First let us look at the anteromedial surface. So the anteromedial surface is this, and it lies between the anterior border and the medial border. Right, so this is the anteromedial because it is between the anterior border and medial border. It's called the anteromedial surface. And here is the anterolateral surface. Now highlighted in pink color is the anterolateral surface, which lies between the anterior border and the posterior borders. Okay, between these two borders is the anterolateral surface. So this is anterolateral surface, this is anteromedial surface. There is one more surface that is behind this one, entirely in yellow color, is the posterior surface. The posterior surface is between the medial border and the lateral border. So the medial border here, the lateral border here. So between the medial and lateral borders on the back side of the bone is the posterior surface of the shaft of the humerus. Now let us talk about the anteromedial surface. This is the anteromedial surface. The anteromedial surface in the upper part becomes a part of the intertubercular sulcus. Right, so we know this intertubercular sulcus, this one right here, that's actually a sulcus that lies between the greater and the lesser tubercles. Let us look at this intertubercular sulcus in detail. See, there is the lesser tubercle, there is the greater tubercle, and this intertubercular sulcus is in between. So this is the lesser tubercle, and this one right here is the greater tubercle. Now in between these we have the intertubercular sulcus. All right, so this part here, this is the intertubercular sulcus. Let me take another color. Yeah, okay, so this is the intertubercular sulcus. So why it is called intertubercular sulcus? Because it is between the lesser tubercle, this one, this is the lesser tubercle, and this is the greater tubercle. So this is called the intertubercular sulcus. the region highlighted in blue color. So this intertubercular sulcus becomes continuous with the anteromedial surface of the shaft of the humerus. Now what we have here in the intertubercular sulcus, let us look at the details. Now here we have some muscles attached. Okay, so I believe you remember the muscles attached here. So we can see this muscle here. What is this muscle? This is the pectoralis major muscle. So the pectoralis major muscle is inserted to the lateral lip of the intertubercular sulcus. Okay, so what is inserted to the medial lip of intertubercular sulcus? There we have another muscle, that is the teres major muscle. Let us find this muscle and insert it. Right, so here is the teres major muscle. So the teres major muscle is inserted to the medial lip of intertubercular sulcus. Okay, so there is a floor. Now there is medial lip, there is lateral lip. Now between the medial lip and the lateral lip, there is the floor of the intertubercular sulcus. So what lies in the floor of the intertubercular sulcus? There lies the latissimus dorsi muscle. Right, that's the latissimus dorsi muscle. So this latissimus dorsi muscle, it goes and inserts to the floor of the intertubercular sulcus or the bicipital groove. Okay, so those are the contents of the intertubercular sulcus. So this intertubercular sulcus is a part of the upper part, in fact, of the anteromedial surface. Right, so what else we have in the anteromedial surface? Please remember that the intertubercular sulcus is also known as the bicipital groove. So why it is called bicipital groove? Because the long head of the biceps brachii lies in this groove. Okay, let us find this muscle, biceps brachii. There is also biceps femoris muscle. That's why it is important to remember this muscle as biceps brachii muscle. See, do you see this tendon? This tendon is the long head of biceps brachii. You can see it lies in this groove, that is intertubercular sulcus, and that is the reason why this is also known as the bicipital groove. Okay, because the long head of biceps brachii lies in this region, that is why. Okay, so here we also have the ascending branch of the anterior circumflex humeral artery running in this bicipital groove. Let us look for this artery. Anterior circumflex humeral artery of the left side. Okay, so here is the anterior circumflex humeral artery. This anterior circumflex humeral artery gives you an ascending branch. See that? The branch that goes upwards. So this ascending branch of the anterior circumflex humeral artery lies in the bicipital groove. So the surface that we are talking about is the anteromedial surface, isn't it? So what we have in the anteromedial surface, we know that the anteromedial surface lies between the anterior and the medial borders of the shaft of the humerus, and in the upper part it becomes continuous with what is called the bicipital groove, or also known as intertubercular sulcus. So this bicipital groove of the intertubercular sulcus has got a lateral lip, it has a medial lip, and it has a floor that lies in between the two. Right, now we know that attached to the medial lip, the lateral lip, is the pectoralis major muscle. The pectoralis major muscle is inserted to the lateral lip of bicipital groove. The medial lip has the insertion of teres major muscle, and lying in the floor is the latissimus dorsi muscle. Now how to remember this easily? It is remembered as this lady between two majors. So who is the lady? Latissimus dorsi is the lady. Who are the majors? Pectoralis major and pectoralis minor. Remember, pectoralis major is attached to lateral lip and the teres major is attached to the medial lip. Lying in the floor, that is the bicipital groove, also is the long head of biceps brachii muscle, right? And we also have an ascending branch of anterior circumflex humeral artery. So anterior circumflex humeral artery, this comes from the third part of axillary artery, isn't it? So these are the contents of the bicipital groove of the anteromedial. That is, upper third of the anteromedial surface has this bicipital groove, and these are the details about the bicipital groove. Okay, now coming to the middle of the shaft of the humerus. Alright, so let's remove this muscle, arterius, and the muscles, remove it. Now look at the middle of the anteromedial surface. Okay, in the middle of the anteromedial surface there is a rough strip. Okay, some muscle is going to get inserted here in the middle part here. Okay, so we'll just highlight this part so that you can see that better. So somewhere here, this part. Okay, so this part presents a roughened strip. So this is present in the anteromedial surface, close to the medial border. Close to the medial border, we will have insertion of one muscle, that is the coracobrachialis muscle. Coracobrachialis muscle. Right, see, here is the coracobrachialis muscle that gets inserted to the medial border of the shaft of the humerus, close to the middle. So anteromedial surface, in the middle we have insertion of the coracobrachialis muscle. Okay, and here we also have a small foramen. This might not be visible in this particular anime, in 3D animated whatever, so we might not find the nutrient foramen. So somewhere here we have the nutrient foramen. So the nutrient foramen is present here in the middle of the shaft, that is close to the insertion of the coracobrachialis muscle. Now going further, in the lower half, the anteromedial surface, right, together with the anterolateral surface. Now where is the anteromedial surface? Now look at this. This is the anterior border. This is the medial border. This is the lateral border. So the lower part of the shaft, as you can see, I'll clear this anime. Okay. Now the lower half of the shaft, from the anteromedial and anterolateral surface, we have the origin of another muscle, that is the brachialis muscle. Okay. So now let us take a look at the brachialis muscle. So the brachialis muscle, brachialis muscle can be seen taking origin. See, look at this. So now the anterolateral and anteromedial surfaces, both anteromedial and anterolateral, both surfaces are covered by the origin of the brachialis muscle. Okay, so the origin, at the origin point, we can see that it embraces this V-shaped deltoid tuberosity. So the origin of the brachialis here is V-shaped, interrupted by the deltoid tuberosity. Alright, further down we have, so let me remove this muscle. Further down, anteromedial surface close to the medial supracondylar ridge. Right, we have this medial supracondylar ridge that gives attachment to the medial intermuscular septum. Okay, so this medial intermuscular septum is actually present here, that is going to separate the flexor and the extensor compartments of the arm. Alright, you can see, well, this is the fascia covering. Where is hide? Yeah, I'm going to hide it. Now you see, this is the medial intermuscular septum of the arm. Can you see? This is the medial intermuscular septum. So it is just a septum like structure, okay, that is going to separate the anterior compartment muscles, that is flexors of forearm and arm, from the extensors of forearm, right? So this septum is attached tightly to the lower part of this border, where it is called the medial supracondylar ridge, and the medial supracondylar ridge provides attachment to the medial intermuscular septum, which intervenes between the flexor and extensor compartment of the arm. Okay, so next to this medial intermuscular septum, okay, in the middle, almost close to the middle, it is pierced by one nerve and an artery, that is the ulnar nerve and the superior ulnar collateral artery. Okay, so the medial intermuscular system, you can see this opening here. Now let me draw the, I'll find the ulnar nerve. So ulnar nerve of the left side, see this, do you see the medial intermuscular septum that is getting pierced by the ulnar nerve here, right? So this is the ulnar nerve, this nerve is the ulnar nerve that is piercing the medial intermuscular septum. Along with this, there is also an artery, that is superior ulnar collateral artery, superior ulnar collateral artery. Okay, see, so these two structures actually pierce the medial intermuscular septum. I hope you are following me. Okay, so here we can see two structures. There is an artery, there is a nerve piercing the medial intermuscular septum, almost in the middle. Okay, so this is about the the surface, that is anteromedial surface. So what we have in the anteromedial surface, in the upper third we have the intertubercular sulcus, and the middle part there is this rough strip for the insertion of coracobrachialis muscle, and in the lower part, this anteromedial surface, there is this thickened and medial supracondylar ridge, which is actually a thickened medial border, and this gives attachment to the medial intermuscular septum, which is pierced by the ulnar nerve and the superior ulnar collateral artery. So the anteromedial surface, okay, so upper one third we have the intertubercular sulcus. In the middle part there is a roughened strip for the insertion of coracobrachialis muscle, and in the lower half it is thickened to form the medial supracondylar ridge, and this medial supracondylar ridge provides attachment. This is actually a thickening of the medial border, okay, medial border, because it is thick, it part of it is seen with the anteromedial surface also. So this ridge provides attachment to medial intermuscular septum, okay, medial intermuscular septum. This medial intermuscular septum is actually pierced by two structures. One is the ulnar nerve and the superior ulnar collateral artery. So the ulnar nerve, as it comes from the medial cord, okay, it pierces the medial intermuscular septum in the middle of the arm, then it goes to the posterior compartment. So that is the context. And then the superior ulnar collateral artery, it is actually a branch of the brachial artery. So the brachial artery, so this artery also pierces the medial intermuscular septum together with the ulnar nerve. All right, so rarely we have a small bony projection of the medial on the anteromedial surface. It is called the supracondylar process. Okay, it is also known as supracondylar spicule. It is also known as the supratrochlear spur, also known as the supratrochlear spur. So when the supracondylar process is present in the lower part of the anteromedial surface, when it is present, it is usually present about 5 centimeters above the medial epicondyle. So when this supracondylar process is present, okay, it gives attachment to the third head of coracobrachialis. Okay, coracobrachialis. See, this coracobrachialis muscle usually has only a single head, but it considered to have two heads, between which passes the musculocutaneous nerve. In lower animals, it has 3 heads, so it is a tricipital muscle in lower animals. Sometimes in humans, a remnant of the third head is found, and when it is present, it will be attached to the supracondylar process, and its remnant is called Struthers ligament. Okay, it is known as the Struthers ligament. So what is Struthers ligament? Struthers ligament is the morphological remnant of what? A morphological remnant of third head of coracobrachialis muscle. Okay, it is not always present. When it is present, it will be attached to the supracondylar process, which is present, when it is present, about 5 centimeter above the medial epicondyle on the anteromedial surface. Okay, in the from the lower part of medial supracondylar ridge, we have the origin of humeral head of pronator teres muscle. Okay, so pronator teres muscle takes origin from the lower part of the medial supracondylar ridge. What is medial supracondylar ridge? The lower thickened part of medial border of the shaft of the humerus. Alright, so that's about the anteromedial surface. Now coming to the anterolateral surface. Where is the anterolateral surface? Let me show you the anterolateral surface. So the anterolateral surface, this is the anterolateral surface, is highlighted in pink color. It lies between the anterior border and the lateral border. That's why it's called the anterolateral surface. Okay, so what we have in the anterolateral surface? The anterolateral surface actually has a V-shaped deltoid tuberosity. You may be able to see this. This is the V-shaped deltoid tuberosity. So this is actually for the insertion of the deltoid muscle. Okay, so this V-shaped deltoid tuberosity is found in the anterolateral surface. It is very close to the middle of the shaft. It's near the middle of the shaft. It receives the insertion of the deltoid muscle. Alright, so now let us insert the muscle, deltoid. Okay, so the deltoid muscle, this is the deltoid muscle on the left side, as you can see this. So here is the deltoid muscle, the insertion of the, look at the insertion point of the deltoid muscle. So it is inserted along a V-shaped impression that is present on the anterolateral surface close to the middle of the shaft. So now if I draw the borders here, along this is the medial border, this is the anterior border, and this becomes continuous with the lateral border. So here there is a V-shaped impression for the insertion of the deltoid muscle. Alright, let's just remove the muscle. So that's the anterolateral surface. What else there is in the anterolateral surface? Below the delta tuberosity, below the V-shaped delta tuberosity, the anterolateral surface provides origin to the brachialis muscle, right? So the lower half of the shaft, on its anteromedial and anterolateral surfaces, we have the origin of the brachialis muscle. Now, similar to the medial supracondylar ridge, there is lateral supracondylar ridge. Now, this lateral supracondylar ridge is nothing but the thickened lower part of the lateral border. So, highlighted in black color now. So, this lateral supracondylar ridge, it gives attachment to the lateral intermuscular septum. Right. So this lateral intermuscular septum is pierced by the radial nerve and the anterior descending branch of the arteria profunda brachii. Okay. So the lateral supracondylar ridge. So what is lateral supracondylar ridge? It is nothing but the thickened lower part of the lateral border. Okay, because it is thickened, it covers a little bit of anterolateral surface as well. So this lateral supracondylar ridge gives attachment to which structure? Lateral intermuscular septum. Okay, now let me explain this to you. This is the, okay, redraw the, so this is the outline of the arm. Okay, I've taken a transverse section of the arm. Okay, almost at the middle, let us consider. Now here is, this is the shaft of the humerus. Okay, this is the shaft. So what we have here, this one, this, so let us say this is medial, this is lateral, this is anterior, this is posterior. So this is the lateral border. Okay, this is the lateral border, this is the medial border, and this one is the anterior border. Okay, so now we have this, the anterolateral surface, this is the anteromedial surface, this is the posterior surface. Okay, so the lateral intermuscular septum. Now let me show you the lateral intermuscular septum. So this one extending from the lateral border to the deep fascia covering the arm, that is brachial fascia. This is the lateral intermuscular septum now, highlighted in green color. Okay, now highlighted in blue color, this one, this is your medial intermuscular septum. This is actually extending up to the deep fascia. From the borders of the bone, you get this. Now this divides the arm into two compartments, right? There is an anterior compartment, there is a posterior compartment. So where is the anterior compartment? This is the anterior compartment, this is the posterior compartment. So how do you know the anterior compartment or posterior compartment? They are separated by this intermuscular septum. So there is the lateral intermuscular septum and the medial intermuscular septum. So this is the posterior compartment of the arm, this is the anterior compartment of the arm. Anterior compartment of the arm has these three muscles: biceps brachii muscle, brachialis muscle, then we have the coracobrachialis muscle. The order is biceps brachii, order is this, okay, coracobrachialis, biceps brachii, and brachialis muscle. So these three muscles will be found in the anterior compartment. Posterior compartment, there is only one muscle, triceps brachii muscle. Okay, so that's the story of medial and lateral intermuscular septum. Now what structure pierces the lateral lateral intermuscular septum? The lateral intermuscular septum is pierced by the radial nerve, and there is the anterior descending branch of arteria, that is profunda brachii artery, arteria profunda brachii. So that's the lateral intermuscular septum, pierced by the radial nerve and the anterior descending branch of arteria profunda brachiae. What is arteria profunda brachiae? It's a branch of the brachial artery. In fact, it's the largest branch of the brachial artery. We will talk about the arteries in a separate video. Now this lateral supracondylar ridge, okay, in its upper two-third, which one? Lateral supracondylar ridge, okay, not the lateral intermuscular septum, the lateral supracondylar ridge in its upper two-third. It provides origin to brachioradialis muscle. Brachioradialis muscle is an extensor, superficial extensor of the forearm in the upper one-third. The lower one-third of the lateral supracondylar ridge provides origin to the extensor carpi radialis longus muscle. It is also an extensor, superficial extensor of the forearm. Alright, so that's about the anterolateral surface. One more last surface is the posterior surface. With the posterior surface, it has to be on the back. So the posterior surface, it is between the medial border and the lateral borders. Okay, look at these surfaces here. The posterior surface lies here. This is the posterior surface. Okay, look at it. This is the posterior surface. Highlighted in pink color is the posterior surface. So the posterior surface is actually very extensive, right? And it intervenes between the medial and the lateral borders. So a very important feature on the posterior aspect of the shaft of the humerus is the spiral groove. Okay, so what is a spiral groove? As the name indicates, it's a groove that runs like this in a spiral manner. Okay, spiral groove. It is directed downwards and laterally. It is also known as the radial groove because we have the radial nerve running in this groove as it goes from the axilla into the arm. Okay, now let us find the radial nerve. Radial nerve here. It's the radial nerve, the left side. You can see, do you see the nerve running downwards and laterally? And the nerve runs in what is called the radial groove or the spiral groove. Spiral groove because of its shape, radial groove because the radial nerve lies in it. Okay, so that's your radial groove or the spiral groove. So this is present in the posterior surface. This is the most striking feature. Along with the radial nerve, we also have an artery running. That's the profunda brachii. So the profunda brachii artery is the largest branch of the brachial artery. Okay, see the artery. So we see two structures here running the spiral groove. The radial nerve accompanied by the profunda brachii artery. Along with this, you will also find the profunda brachii vein as well. Okay, the profunda brachii vein is also seen. Okay, so profunda brachii vein of the right side, profunda brachii vein of the, okay, no problem. So profunda brachii vein, right, of the right side is only shown. Okay, anyway, so this vein also goes with the artery. On both sides, these veins will be present. Right. Now, above the spiral groove, we have the origin of the lateral head of the triceps brachii muscle. Below the spiral groove, we have the medial head of the triceps brachii, origin of the medial head of the triceps brachii muscle. Now let us add the triceps brachii muscle here of the left side. Now look at this, the triceps brachii muscle. So it has got a long head, it has got a medial head, it has got a lateral head. Okay, so this one is the long head. Let's hide the long head of the triceps brachii. When you hide it, okay, oh my god, the entire muscle disappeared. Anyway, well, what we have here is the triceps brachii muscle. So it has got three heads of origin. There is a medial head, there is a lateral head, there is a long head. Okay, the long head of the triceps brachii arises from the infraglenoid tubercle, and the lateral head lateral to the spiral groove, medial head below and medial to the spiral groove. Okay, so here, to the long head. This is okay, right? Okay, I have hidden it. Okay, so come on. Yeah, so this is the lateral head of the triceps. The highlighted part is the lateral head of the triceps brachii. Now highlighted is the long head of the triceps brachii muscle. Okay, now where is the medial head? The medial head of the triceps brachii lies deep to the lateral head. Okay, you may be able to see this. See this is the medial head of the triceps brachii muscle. So the medial head lies medial and inferior to the spiral groove. Lateral head lies superior and lateral to the spiral groove. All right, now so that's about the spiral groove. Okay, so what else do we have here? Well, that's all we have here on the posterior surface. Okay, so posterior surface is the largest and the extensive surface of the shaft of the humerus. The most characteristic feature here is the spiral groove. The spiral groove has the radial nerve and the profunda brachii vessels in it, and this surface is entirely covered by the triceps brachii muscle. Above the insertion of the deltoid muscle, this surface is covered by the deltoid muscle, and above the spiral groove we have the origin of the lateral head of triceps brachii. Below the spiral groove we have the origin of the medial head of the triceps brachii muscle. All right, so that's about the shaft of the humerus. Thank you.